welcome back. I'm Mabel Jong. I'm sitting here now with Bruce Jones, Senior VP, CIO of Excellus BCBS. Thank you so much for your time.
Good morning, Mabel. I'm glad to be here. Thank you.
Yes, I understand it's your first time at HCEG.
It is. So we were introduced to HCEG about 12 months ago or so, and we joined. It looks like a great organization. I'm happy to be a member.
And what are your impressions of some of the content that you've been able to
Very
listen in
relevant.
on?
It seems to be in alignment with what we're focusing on. So, and I like the idea of the top 10 list. It really focuses on, you know, what the objectives are of all of the members. So I think it's a great venue.
That's terrific. Now tell me a little bit about your work at Excellus.
Yeah, so I'm relatively new in the healthcare industry. I was in manufacturing for 32 years at a large manufacturer in upstate New York. I came over to Excellus as the Chief Information Security Officer. Within 2 years, asked to take over as the CIO. So I manage a large organization. We have about 1.5 million lives that we protect. And my responsibility, and I say this to my employees all the time, is I'm really there to serve you and make sure that I'm removing the barriers to getting your work done. So I focus heavily on culture, and I focus a lot on strategy and the direction of the organization, not just within IT, but the company as a whole.
Okay, and so even though you're new to this group here, you've bought into this HCEG Top 10. You've identified a couple of areas that you are looking at very closely. Number 5 on the list, the digital healthcare organization.
Yeah.
Tell me about that. Why did that seem to resonate with you?
A couple of reasons. One is that we live in a digital world today, and everybody is so used to kind of instant gratification, instant support. You go on the Amazon, you get your quick buy buttons, you get a personalized experience. And we need to bring that same philosophy into healthcare, where you log on to your member portal, whether it be on the web or on your mobile device, that you have a personalized experience, that the information you're being displayed is based on your behaviors, your habits, your health plan. And I know that resonates well with our members, having that personalized digital experience.
How is your company going to even focus more in on improving that experience for employees?
Yeah, so great question. A lot of member feedback sessions. We use human-centered design to try and get feedback from our members as to what they're looking for. We know from our website and our mobile app today that the number 1 tool that people use is Find a Doctor, and the number 2 is a healthcare estimator. We need to have more cost transparency. We need to be able to provide that back to our members so that they can go on and get a true estimate of what their out-of-pocket costs are going to be. If I go online today and I'm shopping for something, I shop around to get the best price I can. We need to figure out how do we do that in healthcare so that members can take control of their costs and help manage that.
You also identified number 8, operational excellence. Go into detail about that.
Yeah, so again, I mentioned at the beginning, I came out of manufacturing, and manufacturing has been doing Lean Six Sigma for many years, and we need to transition that into the healthcare space. So we need to look at every single process that we have, figure out what the waste is in that process, take it out, where we can automate it. Robotics process automation has a lot of potential in our space to automate some of the mundane tasks to allow our employees to focus on the more complex, higher value tasks.
And in looking at some of the sessions that you'll be attending and also the ones that you've already taken part in, what holds special relevance to what you're doing at your company?
Yeah, another good question. It's there are so many topics that are relevant to me. I'm most interested in learning more about what other health plans are doing around transparency and the digital business, how they're supporting their customers, where they're providing personalized experiences. I heard of a great one this morning where they're doing cost sharing with their member, where the member can call in and say, hey, I'm interested in, are there other alternatives for imaging that are lower cost? And then sharing that savings with the member. I think that's a great idea to get members to buy into it and let them have a portion of the savings that are resulted in that. So I think those interactions with other payers to understand what they're doing, as well as with the providers of what they're interested in, are of most value to me.
And did you come to this summit with any sort of questions that you had that you hoped you would get some answers to after the meeting was over?
No, being this was my first summit, it was more exploratory for me to understand the group, the membership, how the events are run and what topics, so this was more exploratory for me.
And you must be members of other types of organizations and groups as well. How does this one compare to what you're involved in already?
It's similar. The Blue Cross Association is a little bit unique because we have 36 independent companies across the U.S. and so we get together as CIOs on a regular basis and benchmark, and so that is a coalition of companies already coming together, and so it's similar to that. This one has some unique aspects to it where you've got some of your competitors here, other payers that have different ideas of how to do things, so it's very valuable to me, but it's similar to the other ones I've participated in.
Okay, Bruce, thank you so much for your time. Really
Thank you very
appreciate
much.
it.
I appreciate
Thank
it,
you.
Mabel. Thank you.